Welcome, everyone. Can everybody hear me? Is it too loud? Okay, because when I get excited, I talk even louder, so. This is a subject that I very much have a great deal of investment in. For me, dementia has been a part of my family journey. My name is Carolyn Claver, and I have worked here with St. Odelia Befrienders originally, probably 15 or more years ago, I'm going to guess. And then also with training faith communities around the metro in being dementia friendly. And if you're not aware, St. Odelia does a every other month memory mass during the daytime. They are also doing this now with St. Mary of the Lake. So 1 month it's here, 1 month it's up at St. Mary of the Lake in White Bear Lake. So there's flyers. If you don't find one, give a holler and we'll get you a flyer. We would love to have you come. They've had up to 30 people at those memory masses. So it's something that I'm very pleased that they are doing here. So as I said, my name is Carolyn Claver. I've been an RN for 41 years. Of that, I don't know how many of you knew St. Paul Ramsey, but that's the hospital that I worked at. I floated mostly into the trauma ICU, and then after that worked in the OR pre-op and post-op areas. I did some home health on a ventilator patient of an 18-year-old in his home. But because I worked mostly in trauma, the brain has always been of interest to me. In the last 20 years, my focus has been on dementia. So as I alluded to just a few minutes ago, this has been a journey I've been on with my family as well. 3 of my 4 parents had a form of dementia. My mother and father both had vascular, although not to a very difficult degree, but also my mother and my father-in-law had Lewy body dementia. So I'm going to talk about all of those this evening. My first cousin had Alzheimer's, and she would have had it before the age of 65, so she was considered young onset. I also had a first cousin who had frontal temporal dementia, and I'm going to talk with you about that tonight as well. And he would have been also, as is the norm for many, before the age of 65. All of those folks have passed, and it was quite a bit of caregiving that I did, living 2 and 4 hours away from our family. So working a lot with community resources. So with that, I want to welcome you to this series of 6 that we're going to do. This evening and in April will be evening times that we're doing it. But for winter, we're going to go to afternoon, okay? We'll do one again in November. We'll skip December, and then January, February, March, April. And I think you're going to find the time to be quite full, but I'm hoping it will be very helpful for you. Each evening will be different, okay? So as I said, I'm really honored to be here, and I'd like to just go ahead and jump in, if we can go to the next slide. So the topic for tonight is brain health versus dementia. And the thing that I want us to be thinking on, can you see that picture very well? Or if you have a handout, can you see it in your handout? The question I have for you is, tell me which persons, who on that photo has dementia? That's exactly right. Did anybody hear that answer? You cannot tell. For 20 years, I worked with a program that Ling Blumston ran in faith communities and out in the community called The Gathering. And many church volunteers worked with that program. At one time, I had over 300 volunteers across 4 counties in 10 church sites working with 30 church partners. And when people would pass the room, or if we had an artist who came in and did a program with our gathering people, they would often say, "This is fascinating. There's so much laughter. I would have thought a dementia program would have been sad and just kind of down." And they said, "We don't get that at all from here. It's just full of joy and laughter and support." The second thing they said is, "We have no idea who are your participants and who are your volunteers." And I said, "Good. That means we're doing it right." We were a one-on-one, so every participant had a volunteer. And I want you to know, by looking at this picture, it is possible that there are even some people going into the later stages of dementia in that picture, and you wouldn't be able to know without talking to them, without being in conversation. And the other thing I want you to know, way into the middle stages, some people have their social etiquette down so well that you won't be able to tell well at all into the middle stages. So because of that, I want to have us think about that tonight. Our people with dementia are amongst us. They are our neighbors. They may be sitting next to you in the pew at church. They may be your family or your friends. It's not uncommon that caregivers do not want to tell others that their person has dementia. Why? Because they're afraid they're going to be stigmatized, that they're going to be maybe ignored. So let me give you an example. And it's a poor example, but it's the best one I can think of. So you're going through the grocery store line, and let's take Cub, because it's busy, right? Lots of people. So if I had dementia and the cashier said something to me and I stammered to come up with the right word, would the cashier take any more time to look at me? They'd immediately turn to the caregiver and only have conversation with the caregiver. Not because they're being rude, not because they meant to be disrespectful, but because they're trying to get us through the line, and I would take too much time for them to work with. But that is how often our people with dementia feel. They're often looked past, and the caregiver is the one who has the conversation. Even at doctor appointments, and that's not good. I would often say, ask my mom. She can give you the answer. So it's good to be there as a family and give information together. But I want you to know that dementia is going to look different for every single person. When you know one person with dementia, you only know one person with dementia. They're not going to look the exact same way for everybody. So I am telling and encouraging people, don't drop off the scene when you find out a friend or a family member has dementia. Stay involved. Stay engaged with them. They will feel very respected and loved if you stay on their radar. If we could have the next slide. I want to tell you, just to focus on what does a healthy brain definition look like. That means that cognitively we can think okay, we can sense okay, so the things I touch or see are getting the right signals to my brain. My emotions and my motor, so my walking, my fine motor as well, is all functioning well, and I'm able to reach my full potential. But it also is characterized by the absence of cognitive loss or neurological disorders. Now, that last bullet, this is a really big thing. I gave you a sheet that says on the top in gold, I believe, it says 10 signs. Look at the last line on here, the ability to meet everyday demands effectively. Many of those 10 symptoms have to do with not being able to meet everyday demands. So this is what a healthy brain definition looks like. And with that, I want to go into, if you want to go to the next slide, if you have that Know the 10 Signs sheet out, let's take some time to look at that right now. And I do want to think through each one of these because that's one of the things we're here for tonight, is I want you to hear what is dementia, but also what's typical. And this sheet has both. Now, let me back up 1 second. If you know of anyone, or if you yourself is saying, I worry that I have something going on. I don't know what it is, but I don't feel like I'm like I used to be. If you are saying that to yourself, if you're saying that to family, go to your doctor and have the conversation. That is even more important today than it was a year ago, because I'm going to give you some really great things that are happening in our dementia world right now, okay? So make sure, if you question it, if you're concerned, get in and get checked. If you don't feel like you're getting the answers that you might, go ahead and get a second opinion. Very important. So let's jump into this sheet. Now, the folks here at St. Odelia that have known me a long time have probably seen this sheet every time I talk. It's a really important sheet because it can easily be emailed to family. It can easily be filled out by people. You can easily drop it off at the doctor's office in an envelope saying, my mom's appointment is next Tuesday. I've made notes of areas of concern that I have. If that's how you want to do it, because I would have had a harder time doing that in front of my mom, it was easier for me to get that into the doctor ahead of time. So let's go through each one of these. So first of all, one of the signs that there is something that should be checked out is memory changes that disrupt daily life. So what I want you to think about is, this is when you might forget an important date or an important event. Or asking the same information over and over and over, the same question. Or maybe, now I'm a Post-it lady, so if I normally had 20 Post-it notes on my desk, you wouldn't think twice. But if now you come in and I have 50 or 100 Post-it notes on my desk, you might go, what's up, right? So also, what about when the spouse or the partner starts answering all questions that are directed to me? That can also be a heads up, something's changing. So that is the first one. So if this is a concern you're having with somebody you care about, maybe it's your spouse, maybe it's your brother, maybe it's a neighbor, you can take and write on those 2 lines or write 4 lines worth of information. This occurred where Mom was forgetting where she parked the car, couldn't find her car. So give examples of what you've seen, okay? But do you see in bold, it says what's typical? So how many times have you heard people say, kind of in a joking way, I'm afraid I have Alzheimer's, or I've heard people joke saying old-timers. I honestly don't like that joke because my cousin was in her 50s when she got Alzheimer's. So I want you to know that they have made this really nice in saying what's typical. So you can compare it and say, well, I was worried about it, but now I see that sometimes forgetting names or appointments, but remembering them later is normal. Okay? And the older we get, we don't have that information as readily available as I would when I was in my 20s and working the intensive care units. I can't pull up information that fast anymore. That's normal. The second thing is challenges in planning or solving problems. And so this person no longer can develop a plan or follow a plan. So for example, my mother and father had 6 kids. So when my mom was cooking, it was a big deal, a production. When we all got together with the grandchildren for a holiday and my mom all of a sudden wasn't timing the potatoes and the dressing and the turkey like she had for 50 years, we knew something was awry. And in fact, there was something changing for her. The next thing is maybe all of a sudden there's an error on paying the monthly bills where they've never had an error before, or having a lot of difficulty concentrating and taking a lot longer to do things. Okay, so now what's typical? Now, I don't know, not everybody balances their checkbook like they used to because things are online with the bank, but we can all make errors in our accounting sometimes, can't we? That's normal. But when there's a big thing that's happening, you need to take note and not just say that's a normal part of aging, because it's listed here. Challenges in planning or solving problems, unless it's just a rare occasion, is normal, or is not normal, excuse me. The third one is difficulty completing familiar tasks at home, at work, or at leisure. So yes, you see at work, because some people are being diagnosed as young as in their 40s with this. So it could stop them being able to work and bring in an income for their family, and their spouse may also need to quit work at a young age to take care of them. So this would be the person who has trouble with their daily tasks. Maybe it's that they're having trouble driving. Maybe it's that they all of a sudden can't remember the rules to their favorite game. So think about that, and then if that pertains to yourself or to the person that you're wanting the doctor to hear about, make some notes here. What's typical, though? I have to have help when it comes to a new device, like maybe recording something off the television because it's not so easy as putting in the VHS tape anymore, or possibly with a new microwave with settings. I don't know about you, but it would be my smartphone that I need help with when I get a different phone. The fourth one is confusion with time or place. Now, in the beginning, it might be more immediate time, but people that get into their late stages of a dementia, or for example, Alzheimer's disease, could actually be mixed up with dates decades earlier, okay? But early on, it's usually more immediate, within the few months that we're talking about. But they also could be having trouble understanding something if it's not happening immediately, or they forget where they are or how they got there. So those are all red flags and concerns. But what's typical? Well, I haven't been working. I've been semi-retired since April, and every day is Saturday or Sunday. Does anybody feel that pain with me? It gets a little confusing when you don't have the markings of the days that you're working. So that's typical, but being confused about time or place. So for example, we have people that were in our program. They still were living in the community in their home, but they wanted to go home, and they said it often. Sometimes when you started conversing with them, they were talking about the home they grew up in. So for me, that would have been my parents' dairy farm in southern Minnesota. Well, a tornado took that in 2010. It doesn't exist anymore. So do you see where some of this can get to be quite a stark difference? The next one is new problems with words in speaking or writing. And this is one of the types of frontal temporal dementia. And they may have trouble following a conversation or joining in. They may be saying something and in the middle of their sentence kind of lose track of what they were talking about. They may struggle with vocabulary, have trouble finding the right word, such as instead of a watch, they might call it a hand clock. So they'll call it something different. Now, have any of you ever had trouble finding the right word? I most certainly have. That's typical. But this is somebody, so I'll give you an example. One of our participants, his memory was fine, but he had a lot of difficulty in writing and reading. He no longer could write or read, and he did not want anyone to know that. He was embarrassed about it. Why do our people need to be embarrassed? Because somehow they've felt picked on or stigmatized by people in the community. We've got to stop that. We've got to stand up and say, don't call it old-timers anymore. It's Alzheimer's, and it's a true disease, just like diabetes. All right, the next one is misplacing things and losing the ability to retrace steps. So, have any of you been washing something? Think of something important. Get upstairs and think, now what was that I was going to do? And have any of you had to go back to the washing machine to remember? Yes, that's typical. Because we can return to the washing machine and come up with what we were wanting to do, that's normal. Somebody with an Alzheimer's disease cannot do that. They cannot retrace their steps. So have any of you ever lost your glasses or where you set your keys down? That's typical. Years ago, there used to be an Alzheimer's Association commercial where the woman had opened the refrigerator and put her keys in the refrigerator. That's not typical. Although, I suppose if it was a crazy day, I could do something like that. But would I do it again and again and again? Odd things like that. That's when it starts to be a concern. The next is decreased or poor judgment. Now, this was something that after my father had his first stroke, this was something that was very noticeable. He had been my mother's caregiver since she was 63 years old. When he was in his late 70s, he had his first stroke, and they were on the farm, and he had my mom driving. She hadn't driven in, what would that have been, like 17, 18 years, right? So can you see poor judgment? That would have not been my dad before this incident. So they might have changes in their judgment or decision making. It might also have any of you gotten an email or a text or a phone call where they're scamming you and wanting you to send money, right? Our people with dementias can get fooled into giving large sums of money away very, very easily. Including the telemarketers. Or you might notice that they're not paying attention to their grooming or keeping themselves as clean. So that has a lot to do with vision. As the brain is shrinking and going away, the peripheral vision starts to come in, and as a dementia gets much worse, it goes down to where you have binocular vision only. Notice if you do this, you can't see what's going on out here. As the brain continues to go away, you go down to monocular vision. That means if somebody comes up behind me, I'm going to get very frightened because I had no idea they were there. You need to come at people from the front as they decline. So because of that vision changes, that may be the reason why they don't see that their shirt has a lot of spills on it. Does that help you to understand more? So what is typical is that we can make a bad decision once in a while. The ninth one is withdrawal from work or social activities. So this was something that we saw very much with my mother. She would become embarrassed to go out in public because she was afraid she was going to give the wrong answer. And our family and friends were not looking for the correct answer. They just wanted relationship with her, but she was very conscious of this. So when people fall off the radar, it's good to be checking in. How are things going? And also, when you think about it, falling off the radar might be because they can't keep up with the football game anymore like they used to, or the baseball game, or the bridge games that they used to play with people. So what's typical? Have any of you ever felt weary about your obligations? And sometimes you just want to not go? That's normal. But falling off the radar entirely can be of concern. And lastly is changes in mood and personality. Now, this is the other type of frontal temporal dementia that I'll talk about. But if that area of the brain is affected, it can be with other dementias as well. And that they might be confused, suspicious, depressed, fearful, or anxious, easily upset, when they're out of their comfort zone. Now, what's typical, and I think my husband and I are definitely getting into this, is we have very specific ways we like to do things. Do any of you find you're in that category as well? That's typical. So I hope this is a big help to you. I think having what's typical and what is not typical, having the lines to make notes on, I find this to be a very good piece of paper to be hanging on to and sharing with people. Okay, if we can go to the next slide. I want to show you this because, as you see, I've labeled each area of the brain with what its function is. So when people have had a brain injury from a car accident, when they've had a stroke, it depends on the area of the brain that that injury occurred. Then you're going to see the symptoms. So if they got hit in the back of the head, in that green area, that lime green area, that may affect my perception or my math or my spelling. Does this make sense now as I'm trying to lay out what these lobes are responsible for? So we're going to come back to this in a little bit, but we'll go on to the next slide. So now here is the definition for dementia. And I want you to also know that the next slide will further explain this. But this is not a specific disease. If a person has been diagnosed with dementia, that means that it's just a collective of symptoms. There is specific dementias that people could be diagnosed with, and so we're going to go into that. And this is definitely impaired functioning for normal activities and relationships. So we'll go on to the next slide, because if you've not seen an umbrella used to describe dementia before, the umbrella really does help us give an understanding to dementia. Under that umbrella, your Alzheimer's disease, do you see the yellow area way off to the left? That is the largest dementia that we have. I just heard Dr. Terry Barkley teach on this for the whole day on Friday, and what we learned is the statistics for Alzheimer's is now 75% of all dementias. Okay? The next one that we want to look at, if you go to the third one over, Lewy body dementia, that is the second most common, and it's only 10 to 25% of dementias. But that's Lewy body dementia. And I'll go into each of these just a little bit more in just a second. The next one, as you see on the far right, is vascular dementia. So that's for people who've had strokes, or they've had their arteries are full of plaque and they're not getting the blood flow to the brain that they need, and therefore they're having areas of the brain that are either dying from a stroke or getting poor blood supply. And again, that will only be evident in the area that the brain has been affected. The last one is the frontal temporal dementia. And there are two forms of this. The one affects personality or behavior, and the other is a language variant. So they might have trouble writing, reading, or even speaking. And that is a very difficult dementia. For the people that have trouble speaking, what we find right now is we think many of them know what they want to say or might know what they want to say, but they cannot get it out. Imagine that reality for yourself. That would be very difficult. Okay, so when you look at this umbrella, these are the four most common, but there's actually 50 to 100. There's multiple. We had a person in our program who had MS, and she had a dementia from MS. There's alcoholics that have a form of dementia. There's just oodles. But for you to understand that 75% is Alzheimer's disease, I think is important. The other thing that I want to have you look at, when we talk about the frontal temporal dementia, one of the most important things that I want to impress upon you is that many of our people with frontal temporal that have the behavior variant, the personality changes, they often get diagnosed with a psych problem. They might end up in a psych hospital, but once family presses and says, I don't know, this just doesn't feel right, once they do a brain scan, it's evident that their brain is shrinking in the frontal and the temporal lobes. It's not a psychiatric problem, it's a dementia, okay? The other thing that I really want is for you to be looking at the different types of dementia and know that really it is important to receive a diagnosis. There are people who will go along and be cooperative, not that hard to deal with, and we know what's going on, so we might not feel we need to have that diagnosis. But for my mother and my father-in-law, we needed to know it was Lewy body dementia because there are medications that should never be given to people with Lewy body dementia. And that's the medications that are in the group with Haldol. They can receive things like Seroquel, but never Haldol. It can actually kill them. So there are reasons to get the diagnosis, and that's just one example. Another reason that we want people to get the diagnosis is because the earlier a person is diagnosed, the more we can set up resources. We can get them the help that they need, get them to be able to be a part of making choices. As this disease progresses, what would you like? What is your hope? Do you want to live at this type of an assisted living or memory care? Do you want to have home care? And then get those services set up. That is proven to be one of the ways that they can help people stay in the home longer. If you wait for a crisis to happen, the crises is what we've often gotten involved in with families, and that almost always means that things aren't organized enough to be able to stay at home longer. So it's a very important thing to note. The other thing I want you to know, in case you are not aware of this, but a workup for dementia is 100% covered by Medicare, okay? So that doesn't have to be out of pocket. And I want you to keep that in mind because I'm going to come up with something very important here shortly, okay? In the next slide, do you see the blue arrow? And it's pointing to that red, kind of looks like a comma, or not a comma, but a parentheses. Do you see that? That's your memory center. The hippocampus is the memory center. And what we're looking at is if you were to take an autopsy and cut down the middle and look into the center of the brain, that's what you're seeing. You can't see that from the outside. Next slide. Now, I know not everybody is into autopsies of brains, but I think this is important for you to see. The one on the left is a healthy brain. It's plump, it doesn't have a lot of spaces in it. The one on the right is advanced Alzheimer's. Do you see how much that brain has shrunk? So I want you to see what we're talking about when we're talking Alzheimer's. It's the brain on the right. Now that's a brain far into the disease, okay? What you might not have heard is we now can detect Alzheimer's with a blood test. Has anybody heard that? This is new information. It's called the p-tau 217. This is huge. If we can get an accurate diagnosis of 75% of dementias, this is a really big deal. And in one of my talks coming up, I can't remember what month I'm going to talk about, but I'm going to show you a wheel of all the things that are in clinical trials right now, and there's well over 100 different medications that are going to make their way to market, and it's pretty exciting because 30 years ago, Aricept was our only medication, and it didn't cure it. It didn't solve it. Yes, thank you. So when I talk to you about, I'm going to back up 1 second because this is important. One of the things we know now is that 20 years before symptoms, Alzheimer's is already in the brain. So it can be detected 20 years before symptoms. Imagine how this will change medical care if we can diagnose, for example, myself today and start treatment now. I may never have to live in a memory care. Does that make sense? This is tens of thousands of dollars. A lot of savings to our medical system. And actually to families, because a lot of money is spent out of pocket by families in care. Okay, so let's go back to this Lewy body slide. And the one thing that I want, so with Alzheimer's, I showed you the brain, and I showed you that the brain is shrinking. With Lewy body, it's different because with Lewy body, there's something going on in the brain that actually is causing this. What's in the body with Parkinson's is in Lewy body what's happening in the brain. And with that, they are the Lewy bodies that are in the brain. And with that, it really has an odd set of symptoms that go with it. So both my mother and my father-in-law could be awesome, and then 3 hours later, super confused. Or if my mom was ill, she'd get really confused. But then maybe the next morning, she'd be clear for 5-6 hours. Now, Alzheimer's doesn't do that. Alzheimer's, you start high functioning, and over time, you might hit plateaus, but over time, you decline. With Lewy body, it's almost like a loop you're in. You're doing really well, you're not doing well. You're doing well, you're not doing well. You're doing well, you're not doing well. And over time, you decline, yes. But it's really a very different dementia. This is one of the dementias that can be important to talk to your doctor about ahead of time. So if your partner is acting out their dreams in bed, so when we're in a dream state, our body is paralyzed. But for whatever reason with Lewy body, if they're fighting somebody in their dream, they are fighting with the partner in bed. This is dangerous. Does this make sense? If you know of somebody that's acting out their dreams, this is somebody you should be reaching out to the doctor for. Absolutely. Okay? So we'll go on back to this brain. And so go back to that color. Yes, keep going. There. So with this, what I want you to be thinking about is in Alzheimer's, all of these lobes are shrinking. So all of these symptoms, they're going to have a change in language and understanding and memory. They're going to have difficulty with problem solving. If people live to the late stages, oftentimes their motor cortex, they have difficulty walking. Some will become so far along in the disease that they're in the fetal position. But you can see where perception, math, spelling, where vision is changed. And I talked to you about the peripheral going away and coming into monocular. So I wanted you to see this because in Alzheimer's, all of those lobes are affected. Now let's go to frontal temporal. When you look there at the yellow area and the purple area, that's the areas that frontal temporal dementia is shrinking. Does this kind of help you? This is how I think, so you're getting my way of learning. And then, of course, it's this Lewy body that's in the brain with a Lewy body dementia, so we aren't going to necessarily see a change to the lobes of the brain. And then with a stroke, if I had a stroke that affected my motor cortex and my frontal lobe, then therefore the problem solving, the personality, the behavior, the movement could be the area that we're seeing the symptoms in. So I just wanted you, I'm hoping this helps you to kind of understand why so many different people can have different symptoms, right? The other thing that I wanted, if you've not heard how important it is to have your hearing tested in the last few years, it's really important. Dr. Barkley explained it on Friday to me in a way I had not heard before, so I'm going to read it to you. First of all, if you know you have hearing problems, get in. If you're prescribed hearing aids, get them. If you use a smartphone, my husband has hearing aids for both of his ears, but he also said that the latest iPhone coming out is approved as a hearing device with the headsets. So I don't know if anybody's heard that, but it would be worth asking if that could be of help to you. But Dr. Barkley said, the hearing part of your brain is right next to your memory center. Therefore, your memory center starts to atrophy when it's not stimulated because you can't hear what's happening around you. Does that make sense? Isn't that kind of profound when you hear it that way? You know, you definitely want to get your hearing aids if you are prescribed them. All right. We'll go on to the next slide. Oh, yes. So now we're going to get into some exciting things for me to talk about. So this is a study that just came out July of this year, and it was a 2-year nationwide study. What this did is supported, well, they didn't do it just for me, but since 2009, I've been teaching healthy brain classes, and it supported all that. Because what it said is that lifestyle changes can significantly improve cognitive function in older adults at risk for dementia and cognitive decline. So what did I just say? If you follow these things with a dementia, you're better off. But all of us should be following this to try to have our lifestyle change. Okay, so I want to look at this a little more closely. Let's start first with physical exercise. Do you know if you just did 30 to 35 minutes 4 times a week, or for me, I have chronic fatigue from COVID. I've had it for 5 years. For me, 20 minutes of exercise a day is more doable. But what we know, and I'm happy to be the age I am. I don't want to go back and redo the years that I've had before. I've had a good life, but I'm happy where I am. But exercise is the best anti-aging thing you can do. Not going to a plastic surgeon, just get out and exercise. Your body will age much better with exercise. The next thing is health monitoring. So what we're asking is that you get in for your annual physical and you follow. If they tell you you've got high blood pressure, get that medication and keep taking it regularly. Watch your blood pressure. If they're telling you to be treated for high cholesterol, get that medication. Those statins are important. If they're telling you that you're borderline diabetes or you need to do certain things for your diabetes, do them, because that is very, very important. So be following what your health monitoring is being your results that you get from your doctor each year. The next thing I want to skip across to is cognitive exercises. So the group respite that we ran and still run is called The Gathering. And I can tell you multiple examples of how well people did when they stayed active with their brain. By getting out and socializing alone, and then doing things that are new and different that you can enjoy, your brain will be so much more healthier than if you keep doing the same thing every day, and if you stay in your home and only have the TV. You will decline quite rapidly because socialization is proven, and learning new things. You don't have to become an expert, but you do need to enjoy the new things that you're learning. If you're not enjoying it, set that down and get something else to learn. So don't keep doing the same things. For cognitive exercises, did you notice Lumosity and Brain HQ? Those are two online sites that you can do. These people were on online programs for brain stimulation, and those are a couple examples that you might be interested in. But get out and play games, visit with people, volunteer, do things that can help exercise your brain. The last one that I want to show from this particular wheel is the one for nutrition. And what I want you to go to, did you get the handout that has got the, it's got where you can tally, it's got different foods. It starts out with green leafy vegetables. I will tell you, this is one that I downloaded and I am personally using it. I could stand to lose weight, but I didn't want to start with losing weight and following this at the same time. So what I'm doing is I'm using this as a tally. So yes, I might have desserts every night of the week. It's the Norwegian in me, forgive me. But can I eat several green leafy vegetables throughout my week? Can I get several vegetables in? Do you see how it follows right down? And just tally as you go through the day, then add across for the week, and you can see how well you have reduced your risk. This is called the MIND diet. It means the Mediterranean diet. Have any of you heard that? It's all of those foods on that list are what they're pushing. What they eat in the Mediterranean has shown to be heart healthy. It's the MIND diet, the Mediterranean diet plus the American Heart Association's DASH diet. The heart healthy diet, it's those two combined, and that's what's given for you on that tally sheet. I like it well. So if you think about the MIND diet, what you're looking for is your plate should be loaded with color. Absolutely loaded with vibrant color. Does that mean iceberg lettuce? No. It means spinach, kale, it means red cabbage, it means beets, kiwi, dark berries, your strawberries, your blackberries, your red raspberries. Are you getting the picture? The color should be vibrant on your plate. And your vegetables and fruit should take up a majority of that plate, with a fair amount focused also on protein. You want to make sure to get an adequate amount of protein as well. So follow what it says on there. It encourages you on certain things. Our family eats a lot of pork and beef, and we're trying to eat more fish. So that sheet, by tallying, you can see if you're following it well. So what we know by following this pointer brain health recipe, people can prepare themselves for their later years to be at the best that they can be. So we'll go on to the next slide. And what I want to talk about is the things that weren't on the pointer study. Number one is getting a good night's sleep. If you're struggling with sleep, make sure you talk to your primary doctor about it. You should be getting 7 to 9 hours of sleep a night. Unfortunately, with my chronic fatigue, believe it or not, I'm at 12 to 15 hours of sleep a night. But that's my normal. If you're taking a nap, you should only take less than an hour a day. If you nap too much, that will affect your sleep at night. The other thing that I want you to know about is And Dr. Barkley, I've heard him say this probably 15 years ago, and now I heard him say it again, and that is, for women, you should not drink more than one alcoholic drink a day. And what he was saying, I thought, was a great point. It's the restaurant pour of wine, not the glass of wine you pour up, right? It's one restaurant pour. For men, it should be less than 2 drinks a day. And nightcaps are not what you need. Alcohol is not good to have at bedtime. The other piece that I think, if you've not heard this before, for those with diabetes, hypoglycemia, low blood sugar, actually kills off brain cells. So making sure your blood sugar is high enough to be healthy, but then not so high that you're off the charts also and needing more insulin. And if I didn't say it before, I want to make sure that you're doing fun challenges. See the social group there? So we can't control our lifestyle. We can control our lifestyle. We can't control our age, and we can't control our genetics. But there's still a lot. There's a lot you can do, and I want to encourage you. As we get into these sessions, one of the nights I'm going to talk a little bit more on the Nun study, but neuroplasticity is where your brain can change to be able to help you. So for example, with my dad, after a stroke, they worked with him in therapies for quite some time because he could no longer use his right hand. Could they help him to use his left hand to sign his name? That's because of neuroplasticity. His brain was able to change enough for him to get the skill of being able to sign his name. So neuroplasticity. The other thing, when I'm encouraging you to be social and being out learning new things, it's because you want to build up as much cognitive reserve as possible. That's why in our 4 hours of respite, we're trying to do new and different things, trying to have joy, trying to learn, because even people with dementia, if we can keep them on a plateau for as long as possible, I'll give you a premium example, and that was during the COVID shutdown. I was very afraid our people that were in our program would have drastic declines. So we started doing a program online during that shutdown. It's really, we all experienced it. It was an awful time, right? That socialization and keeping interested in things is very important. We want to build as much cognitive reserve as we possibly can, so if something happens where we were to come down with a dementia, we want that we won't have symptoms as quickly as our brain might be showing that we could be having symptoms. Okay? I'm going to take a peek at my watch. We're doing great on time. I'm going to go to the next slide. So these are our next sessions. November 12th, although you might think, well, I really don't have people that I can help. I do have a lot of really good stuff that won't fit into the other nights. So next time in November will be a lot of great information. And it really does take advocating for many of our people with a dementia to have the supports around them, have the friends continue to come in, be able to get to church, and be out with our family and friends. So that's November 12th. We won't meet in December. And then we'll be, do you notice that the time switched to daytime through March? I also want to go into, in January, working with Dementia Care Challenges. And actually, I can't even tell you, Deacon Jim doesn't know yet, but I think I have probably 50 different pages that if any of you are having struggles, that we can find something that might give you some help. Plus, I will have people that I can refer you to for one-on-one help as well. The dementia communication techniques in February, I trained volunteers in working with our participants for 15 years, and communication was the biggest part of the training. Because if you can learn to communicate well with someone with dementia, you really can communicate with anyone. Because people with dementia will read your body signals much quicker than they'll be paying attention to what you're saying. And if I'm standing with my hands on my hips and stomping my foot, right, they're not going to be happy with me, even though I might be telling them how wonderful they are, right? So I really encourage you, if that sounds boring, it's actually really, really important. On March 11th, we're going to talk about the resources throughout the metro, and I am going to have an agency come in that night that works across the metro. And then in April, we're going to talk about the significant role of spirituality in the church, and actually that has been a study. And it's really quite fascinating. Spirituality and faith in dementia should not be overlooked. If you did not see the flyer, St. Odelia does a memory mass every other month. They partner with although they've been doing it since I think 2017, St. Mary of the Lake came on board recently, and every other month, they're doing it when St. Odelia is not. So you can go to one or the other, and they've had about 30 people at most come to these. So it's really a lovely time of being together. So what I'd like to do right now, you can go to the next slide if you would. I'd like to take time for questions because I'm guessing that I might have said something that made some people wonder a little bit more. Any questions? Yes, Eileen.
If someone thinks maybe it's time for an assessment or at least to begin some conversations with healthcare providers, is it likely to be most recommended that they see their primary care physician, or do they jump to a neurologist, or where do they?
Yeah, so the question is when someone is thinking that they need to see a physician about changes that are happening, whether it's with themselves or with somebody that they care about, where to start. So most people can see their primary and get help that direction. If there are unusual things like with frontal temporal, whether it's communication or behavior, if there's unusual things because they've been diagnosed with something psychiatric when you don't think that's what's going on. So the unusual things, I would definitely not think twice about going to neurology. And my understanding from what Dr. Terry Barclay said, he's a neuropsychologist, he said you do not need referral to see neurology. But I do know that they're very, very busy and it can be hard to get in. So if things aren't unusual, you can, and you're feeling comfortable with what your primary is doing, you can stay with your primary. But I would not hesitate to get a second opinion if you wish to get a second opinion. Does that help? All right. Next question? Yes. Oh, gosh. Yes, thank you so much for taking me. I skipped that one. And that one's actually really fascinating, so I want to talk about that one. So she was asking if I covered on this Know the 10 Signs, number 5. And that is trouble understanding visual images and spatial relationships. I had a psychologist that I worked with for quite a few years. And his first symptom was he had trouble with spatial, so he couldn't see how close you and I were. So as we were we were doing a Tai Chi class, he would walk right up into the instructor's face because he couldn't tell the distance. Imagine how dangerous that is if he couldn't judge a stop sign when he's driving, right? Also, that's the spatial relationships. The visual images, it could be that they're having trouble with color and contrast. It could be that, so some of our people, as they pass a mirror, they will think someone else is in the room. What I will tell you is it's not uncommon for later in the disease that they have gone back in time in their mind. So they see themselves as a 20, 30, 40-year-old, even though they might be 85. So when they go into the restroom, they're afraid because there's an old person in the restroom. Does that make sense? This really does happen, and at our program, we would have to put gift paper or paper of some sort on the bathroom mirrors so that we wouldn't upset our participants that had this difficulty. And that is something that caregivers can do at home too, because they can be very distraught over somebody's in the house. So what I want you to know is that if any of you have had cataract surgery, I mean, my husband talks about how much different vision, the brightness of the room has changed with cataract surgery. That's typical. But these visual changes that we've talked about are spatial relationships. Something is going on in the brain, in the occipital lobe, that's causing that. Yes?
I had heard that the simple test that the doctor used to give you to go in, memorize these 4 or 5 items, is a good indicator of pre-dementia or early signs.
It can be. So we call it a mini-cog or a cognitive assessment that they do. However, I'm going to give you an example. My friend and I were nurses together in the pre-op, post-op area, and she has been diagnosed with mild cognitive impairment. They sent her to occupational therapy. She did several appointments. They worked on memory techniques and such, and she went back and she no longer has that diagnosis. So MCI, mild cognitive impairment, does not mean that you will get dementia. All it means is that something is changing, we don't know what, they're not quite diagnosed with a dementia, and if they can get to work with someone on this, they could improve. And that's mild cognitive impairment. It does not mean that there's a dementia. Yes?
Related to that question, I found out after the fact that my spouse had failed that test visibly a couple years before I ever took her into her primary care doctor, but they never communicated. What's the responsibility of that?
Oh my, did you all hear that? So he found out 2 years after the fact that his wife had miserably failed that cognitive assessment, but he was never told. Therefore, I'm guessing nothing was ever done because you weren't aware, right? Yeah. And so I think your question was, what's the responsibility on that end? So I'm going to tell you, this practice of medicine is a tough one. This practice of nursing is a tough one. Not only do we have things that are tough days, but we also get to be fond of the people that we work with, and it can be hard to deliver a diagnosis. So not all primaries will give the diagnosis because it's difficult. However, I will tell you that it takes a huge team to be a part of this. It takes maybe your spouse hasn't signed off that you can have conversation with a physician, but if you can give as much information that way to them, saying, I'm worried, has there been anything done for this? Are you noticing anything? Do we need to be doing anything further? Short of that, no. That's a difficult one. If you're not told and you could have done something for 2 years, Think about that. In those 2 years, they could have gone to their financial planner and made a plan for what's ahead, right? In those 2 years, they could have worked on how do we want to present this to our family, to our siblings, to our children, to our nieces and nephews, to our neighbors and friends. But you were denied that opportunity. And was it possible that she was quite a bit along when the diagnosis finally came? Was she quite a bit further along in her dementia when the diagnosis came? Yeah. And we want people to get diagnosed as early as possible so they can be involved in the choices. The further you get along in a dementia, your insight starts to go away, and it's harder to be able to think that through. I think that oftentimes early on, people would say, you know, if I get to be where you're not getting the sleep, your health is declining, you need to put me in a facility if that's what it takes. But people that get far along into this disease will not often say that because they don't have the insight that they have gotten that far along. So, I don't know. It wasn't the answer that's pleasant, but it's unfortunate. Because to me, if there was somebody that didn't pass that, I would hope that the significant other would know enough that they could get engaged in what to do next. What is our steps to do next? I'm going to tell you that it's not that the primary physicians aren't doing a good job. They have got a huge task. But the clinics do not do as good of a job of getting people to the resources. That is why I want you to be thinking of coming back to what we have to offer, because there are good resources out here. And we want people to know. If all you get those resources for is a neighbor, because possibly when you went through this journey, you didn't have a lot of resources that were given to you. Possibly. I'm not sure. Okay? Yes?
Earlier, you commented on hearing.
Yeah.
I've been affected by loss of hearing most of my life.
Yes.
I have been prescribed hearing aids, which I find to be a big problem.
Yes.
I hate the feeling. I can sit here and hear you.
Mm-hmm.
So I don't wear them. Should I be wearing hearing aids?
I'll tell you, it's not an easy answer. So his question is, he's been struggling with hearing most of his life. He doesn't care for his hearing aids, they're a problem. He comes to this, he can hear what's being said. Should he be wearing hearing aids? I will tell you that hearing aids have changed drastically in the 41 years that I've been a nurse. And I can't tell you how many times people's batteries might have been dead in their hearing aids and yet they were wearing them. So what was the hearing aid doing then? It was blocking sound from coming in, right? I know that I think my husband's hearing aids are like $5,000. They're so technical, and the batteries and the cleaning, it's so specific, and you got to keep up on it. So I don't know how old your hearing aids are, but it might be worth a visit to an audiologist. And the other thing is, if you have a smartphone and you're using an Apple phone, you might want to go to the Apple store and try those earbuds that help with hearing. Because when my husband got his last iPhone, my son was able to put into the iPhone what the audiologist had, what the test was. So he could hear better, but he found that he also wanted the hearing aids because they helped with other things. So it's a hard one to answer because there are a lot of people that don't like them. So I'm going to give you my opinion on how to handle things. If my mom passed away when she was 92. If she had been wearing hearing aids at that age and hated them and didn't want them in, I would not have requested and required that she wear them all the time. Because if she was far along in her journey and she'd hated them most of her life, why would I want to put her through the misery of forcing her to wear them now? Because I went to a talk that said you have to be able to hear or your brain is not getting stimulated, right? So where are people on the journey? What has been the pattern their whole life? And is it something that in their late stages you want to be starting? Now for yourself, again, I think I'd have a conversation with an audiologist about it. Does that help? Because it might be very different today from what you have. Yeah. Anybody else? Yes.
Is it a good idea to get that blood test?
Okay. So, you've heard of ethics in medicine, right? Some families have Alzheimer's that runs in their families. So now the question is, do you send your whole family to get that blood test because do you want that 39-year-old to find out that they have Alzheimer's going on? I don't know. Is it possible they could be put into a clinical trial that might help them later? Then maybe so, right? But do you see where it now starts to get to be a little muddy? Because it starts to get complicated. There is families that have a gene, and I'm sorry I'm not as technical on some of this, but I think it's the ApoE4. So if you've read, these are the people that have, so there was a family, I want to say Guatemala, and all of the adults were getting Alzheimer's by the time they were in their 30s. Okay? That's very different than what the average the average is for people to get. So that's a specific gene that they would be studying for. Obviously, I would want, if I were one of those families that it was occurring too young, I would want to know so we could be getting any help that we could. One of the evening or days that I'm going to talk, I'm going to show a wheel of all the medicines and where they're at in clinical trials, whether they're in phase 1, phase 2, phase 3, and all the different categories, because some of these will work with behavior difficulties. This is big. It's huge. And I worry when some of these researches have been stopped, because we cannot get back decades of research if it all gets thrown. We've got to keep this going. We know that Alzheimer's and dementias alone will break the healthcare system as we know it if we don't get on top of this. This is a very, very critical public health issue. Any other questions? Yes?
Do you have a special trick or advice for dealing with agitation?
Yeah, so that's on that night with difficult things that occur. I will talk about that more. I will tell you that with the participants, and we would work with upwards of 100 participants a year. One of the pieces that is really critical, did you hear the question? He was asking what techniques, what can you do for working with people that have agitation? So this also ties in with that night on, or that day on communication techniques. The first thing to do is to get to their level. So I wouldn't want to be standing up here talking down to them. I'd want to be sitting in a chair next to them. I'd want to be at their level so I'm not towering over them. I don't want my hands on my hips. I want to watch my body language. I want to make sure I'm pleasant, I'm calm, I'm patient. I want to make sure that I validate what they're saying. If they're saying, I need to get home to my mother, and you might be thinking realistically, her mother died 50 years ago. Okay, your mother died 50 years ago. You're not going to go see your mother. Well, that's going to naturally cause me to be angry because I am thinking that I need to get home to my mother. And why would you tell them that their mother died 50 years ago when that part of the brain is gone? Because now I'm going to grieve it as if it's the first time I've heard it. So instead, You want to get on their level. You want to join them in their conversation. Tell me more about your mother. What were the special things that you did with your mother? So start having a conversation about what they're concerned about. The next thing, so I'm going to give you an example of one of our participants. Now, churches have locks on them to keep people from breaking in, but we don't have locks to keep participants from going out. So one of our participants was for sure going to go. He had to get home, and the only thing I could do was walk with him. And there was like 3 inches of ice on the streets, but I was moving with him. And I'm just talking about whatever as very casual as I possibly can. Oh, I remember I met your daughter last time. She seems like just a really sweet person. Oh, yes, I love my daughter. We do so many things. We fish together. Then I got my cell phone out and I called the daughter and I said, hey, your dad and I happen to be out for a walk. We're not far from White Bear Avenue and whatever street it was, and if you'd like to join us, we'd love to have you come. So do you see how the whole time I'm not freaking out? I'm not saying, oh my God, he's left the church and we're out on the icy streets, because now if I'd done that, I would have upset the person. And I don't want that. I want a working relationship. I want them to be working with me. I want to be validating how they're feeling. So I need to get going. I've got to get home, and him leaving. I didn't say, you must not leave. I said, oh, let's try to call your daughter. When I couldn't get him to join me to sit down and make the call, when he went out the door, I went out with him. And I walked with him. And the minute I was able to get him off of thinking about needing to get home, I tried to change the subject and distract him to bring him back into the church. It never got to that. I could not get him off of that topic. But you have to join them as much as you can and not upset them as much as you can, because we are functioning with all our lobes intact. They are dealing with what they can, with what they have. And it's up to us to figure out how to work with them. And that may mean that you end up calling 911 and saying, it's really icy out here. I'm afraid my wife and I, or my daughter and I are out walking, and I'm afraid we're going to slip. Is there anybody that can come and help us? Do what you need to do, but you do it as calmly as you can. And really, it's because of some of those things that get to be so drastic that people sometimes need admissions. But when it only occurs on different occasions and it can be managed, that's when we want to educate people on how. Is that of help to you at all?
It's hard to do.
It's very hard to do. However, what I'd like to do, now I know who you're in contact with, so I know you're in conversation with Amy, but we can also make sure that you get somebody to talk one-on-one with that works with us regularly if you'd like, so let me know, okay? Yeah. Any other? Yes?
I know this is being live streamed. Is it being recorded so that I can pass this on to some people that listen?
Yes, this is being recorded, so this can be passed on. I'm not exactly sure how it will be available, but maybe Deacon Jim, as time goes on, will let us know how we can access it. Definitely Deacon Jim through the office will have that information. So it's live streamed and recorded, and you're free to give these handouts to anybody you wish to give them to.
Are they electronic someplace so it's easy to pass them?
Yes, if you want it, make sure, and I'll take your name and I'll send you an email with them. Yep, I'll get you a PDF of them, yeah. Any other questions? This is a complex issue, and when I say when you know one, you know one, that means that the answer could be just a little bit different for every different scenario. And I don't know. To me, this is a specialty that I've very much been honored to work in. It's affected my family. If I can figure out how to help people, hopefully other people are helping my family along the way. This is not a journey you want to do alone. This is tough. And I will tell you, this faith community is really warm about working with their people that have dementia and Alzheimer's and Lewy body and frontal temporal and vascular dementia and other. And having that in your faith journey is very, very important. We had a family that came to the Mass, let's see, I want to say last fall, and it was 4 generations. And the granddaughter had brought her baby with. It was her aunt and her grandmother. And the grandmother had had a head injury, which had caused a dementia. And she had not been to a Mass or a church service in 23 years. The granddaughter was crying because of how important it was to be at that service. And you know, I don't know about you all, but our faith journey is a part of who we are. And if that piece gets taken away because of a dementia, that means that you have totally lost a practice that was very near and dear. When I was a nurse at a church for 9 years and did home visits, I often would take the hymnal. And I would usually take the old hymnal because that was the songs that many of the elderly knew the most. And we would just sing hymns from the hymnal. And it's very dear. Have you been with people as they've passed to pray the Lord's Prayer? You know, and there are people with dementia that haven't been able to speak for a long time, but they can pull out words to songs and they can repeat these prayers. Now, if that doesn't give you holy goosebumps, I don't know what does. To me, that's really precious. So, any other questions? It has been a real delight, and if I get to where you ask questions that I don't know, trust me that I'm going to tell you that I'll find an answer and I'll get back to you. So encourage others to come. I know it was a beautiful evening, so take good care until next month, okay?
Thank you.